Good morning, everyone. Thank you for joining us this morning for our Women's Business Council meeting. So excited that you're joining us for your first hour of your day today. We have a great presentation lined up today. For those that don't know me, I'm Jonathan Porges. I'm your market manager here in Boynton Beach, and I'm joined by my colleague, Allison Muccio, who is our membership manager. And before we get into the program, I just want to go over a few things. We will be recording this program, and we will send you a copy of our a link to a YouTube page so you can review it later. We ask that you hold your questions to the end. Inside the screen here, you'll see a chat box, and you can put your questions in there. Allison and I will be monitoring that chat box throughout the presentation, and we will ask those questions at the end of the presentation. With that, we're going to do a quick 30-second introduction from everybody, and Allison will run that portion of it, and she'll go by the screens she sees on in order of the screen she sees on her, in order of the names she sees on her screen. How do you like that? I think I need my coffee. I haven't had that this morning. So with that, I will turn it over to Allison, and she will go through the introductions.
Thank you. Good morning, everybody. So nice to see everybody today. I always look forward to hearing Brazelia. She is just literally one of my favorite people and so smart, and you're going to learn a lot today. So without that, we're going to go 30 seconds so we can get around everybody because we don't want to miss a word that Brazelia has to say. And let's jump over to Wendy. Wendy Rosenblatt, good morning.
Good morning, everyone. Wendy Rosenblatt, Style You. What I do is I take people to independent living, assisted living, and memory care at no cost. I can still do virtual tours now, actually meeting people outside with face masks on and standing social distancing apart. Good morning, everyone. Please think of me so I can help your family out when they need to move out of their own home.
Thank you. Lena, good morning.
Hi, good morning. So we specialize in electrostatic disinfecting. We also do power washing, exterior power washing for sidewalks, driveways, rooftops. We've been working with a lot of realtors for their showings and, when a home seller sells their home. And we're also doing a free disinfecting for one daycare and preschool every week, and we do our live drawing on Instagram every Wednesday. So if you guys want to participate, we're always looking for sponsorships.
Thank you. Hi, Roz.
Hi. Well, I'll share more when I do the intro too, but I'm Roz with Everything Logo, helping you keep your message out there on promotional items, and also able to supply PPE products, the hand sanitizers and face masks, blank or imprinted. Might as well put your name on them and let them be advertising for you while everybody's using them. But anyway, I'm just here to help out wherever I can and connect people.
Thanks, Roz. And the birthday girl a few days ago, Jordana.
Thank you so much, Allison. Good morning, everyone. I'm Jordana Foster with Ready, Set, Go Beyond. I'm a mindset coach and business strategist certified with John Maxwell team, and I'm passionate about helping entrepreneurs, businesses, and organizations to get out of their own way with mindset shift workshops, communication to connection workshops and training programs, leadership, and helping internally and externally with the clients that you're dealing with, how we are communicating, and to turn it into really more of a deeper connection and how we can all help each other and collaborate. And I think we all need to get out of our own way and really strive for the best that we can be. So it's wonderful to see all of you here.
Happy birthday.
Thank you so much. To you too, Lena. You were the day after me.
Oh, happy birthday, Lena.
Thanks.
Let's jump over to Susan. Good morning. Can't hear you.
Can you hear me?
Yep, now we can.
Okay, great. This is only my second meeting. The first one I had no sound. I am a certified ICF coach. I do both work with individuals, any size business, as well as the government and the intelligence community. And I basically have at the foundation of my practice, I have an expertise in positive self-talk, resilience, and life and career transition. So if you know anybody who is having unproductive thoughts, anybody that needs the motivation to move forward, I've also done a lot with conversational intelligence, which is being used at all the major companies today and universities, helping people understand the fight or flight experience. My passion happens to be the neuroscience, so I understand how you take people from that flight or fight and get them into a more productive mindset. And I do. And I also authored a book called Talk Yourself into Success. And I'm happy to be here. Thank you.
Thank you, Susan. Catherine Strader, how are you this morning?
How are you? I'm Catherine Strader with Legacy Bank of Florida. I'm the Sales and Service Manager at the Delray office, downtown Delray. We are a community bank, but we're the largest community bank in Broward and Palm Beach County. And we do everything that the larger banks can do, but we give you that extra personal service. Thank you.
Thank you. Good morning, Pat O'Meara.
Good morning. How are you? Let me just turn this off. Hold on. I'm sorry. I've got a feedback. Thank you, everybody. I've got a feedback from the other device. I'm with Trustbridge, Hospice by the Sea, and Hospice of Palm Beach and Broward County. Of course, we've been serving this area for close to 45 years. And we just want everybody to know that we are taking care of COVID patients in many of our units, which now enables, sadly, for family members to actually visit with their loved one through the outside window. So we have opened up units in many of our facilities, and we're trying to take care of as many as we can. And we provide the care in the home as well, bringing a lot of supplies to family members and helping them get through this time. Thank you.
Thank you, Pat. If everybody looks at the chat, we just got a message from Karen Isaacs, who introduced herself because she does not have audio. So let's jump over to Cara Clapp. We don't get to see your pretty face today. Oh, there she is.
I have, I'm remodeling, as you know, Allison, so he just got here. My dog was going insane, so I had just kept myself off. I'm Cara Clapp. I'm with Sack Lunch Agency. I haven't been part of this before, but I was looking forward to Brazelia's talk because she's fascinating and knows a lot. And we are a full service agency. We do branding. We specialize in branding, anything, a lot of package design. We have about 12 beverage clients. We just designed a tree service company yesterday. So we really kind of do anything. And we also are the only agency with a full in-house printing house. So we can print anything and we can create anything. So, Cara Clapp.
Thank you. I am so sorry, but I do not know how to pronounce your first name, P. Baker. Can you let us know how to pronounce that?
Sure. Good morning. Can you hear me?
Yes.
Good morning. Oh, okay. It's pronounced Patheria.
Oh, how pretty. I would have completely
Patheria Baker with the, yes, with the healthcare thing. Yeah, I was a nurse midwife back in the 60s who gave me some extra letters. So that's the way it's spelled that way. Healthcare District of Palm Beach County right now, known for all the COVID tests now, but county's healthcare safety net, trauma health, all those
audio
operate
literally...
hospital, Lakeside Medical Center. Oh, yeah, I know it's on my computer, so maybe I should put it in the chat also.
Yeah.
Yeah, I'm having problems with my connection, so maybe I should put it in the chat.
That would be great. Thank you.
Okay, thank you.
I saw Beth Wagmeister, but I think we lost her. So I guess with that, I will jump back over to Roz.
Wait, I think we forgot Karen. Oh, no, she couldn't get in.
She put hers in the chat. It's all
Hi,
Roz.
everybody. Well, welcome everybody. Thank you for joining us today. I'm Roz, the co-chair of the Women's Business Council, along with Catherine, wherever you are, wave. And go back to gallery view there. Okay, hi Catherine. And anyway, so glad you all could join us today. It does sound like a fascinating topic, and Dr. Brazelia understands your health and well-being are top priority. We know that, and especially nowadays, right? So she gives you the time and attention you deserve and prides herself in knowing that you'll receive a tailored protocol specific to your restorative treatment. And she's president and clinical director of Brazelia Med Spa in Boca Raton, and a doctor in Oriental medicine, naturopathy, and acupuncture. And with many, many certifications behind her and a wealth of experience, she currently works directly with Dr. Herbert Slavin at the spa, and he specializes in anti-aging medicine. And he's a naturally recognized leader featured in Suzanne Summers' book, Ageless. So a lot of credentials behind her and who she works with. And she's also dedicated to very active in the community, personally and professionally. And it's a fascinating topic. I'm sure we're all anxious to hear how to take our health back using ancient and modern technologies. So Dr. Brazelia, take it away. Uh-oh, don't hear you.
Can you hear me?
Yes.
Okay. Now, does everyone see this presentation? Okay. There we go. Perfect. Okay, and we clear? I was having quite a bit of technical difficulty this morning.
No.
So I just want to make sure, yes, I see that on the screen. So thank you so much. My name is Dr. Brazelia Lazzari, and I own Brazelia Integrative Anti-Aging Center. There's my email, and there's my phone number. I'm going to go through the slides because there are quite a few. And I know that I have a certain amount of time space. I'm going to cram in as much information as I can. And then anyone that has any questions, by all means, please feel free to email me, call me, or certainly at the end of this, we can go through everything. This is my background: an undergraduate degree in FAU, a master's degree in Oriental medicine, and my naturopathic degree from American Naturopathic Institute that was in Texas. I started my practice here in 2003. So as everything logo, I didn't quite catch her name, but I did catch the name of her company mentioned. Yes, I have a lot of degrees just because this is my passion, my everything, knowing that our body's a diagnostic tool and how we can utilize that to really be the optimal self that we all would love to be. And so I specialize in integrative and functional medicine. And I'm a public speaker for many topics, as well as an advocate for cannabis medicine. So this is my front. And then within the practice, I do have a retail section where I do sell my line, my private line, which is all functional medicine. So I say functional medicine. What that means is functional medicine is the highest grade of medical nutraceuticals on the market and governed by a functional medicine organization that says the efficacy, what is on that product is what's in that product, and it's free of soy, wheat, yeast, so it's a very clean product. So as usual, being in the medical industry, I always put out the disclaimer. I'm not going to read it for everyone. You guys can see it, but this is only for informational purposes only, and certainly not, basic intent to cure, diagnose any disease pattern. And so that's what we're facing today, which is this paradigm shift in medicine. People are tired of taking all the medication. They want to feel good. They're just dragging and not understanding what's happening in their body. And we need to focus on prevention, not on, you know, the actual disease pattern or whatever that may be. I have many schools of thought in that capacity, where it even goes into subconscious and mind, vibrational therapy. But for the sake of this presentation, I'm going to keep it geared towards the integrative medicine. So that term is being used quite often today. And what that's basically expressing is that now it's a physician-patient interaction, which I love, because the patient has to understand their health and their entire regimen. Oftentimes, unfortunately, in the allopathic world, they're giving a prescription and say, here, just take this, and that is it. But do you understand fully what is going on in your body? And hence, you are the diagnostic tool. So there are many ways to help that in a natural level. And sometimes we blend the two. We meet East with West so that we have that optimal level. And so that's really what integrative medicine means. It's that dynamic between the physician and the practitioner. And then within that is the mind, body, and spirit of that person. So we're taking in the dynamic of all those health patterns. So again, it's the provider-patient interaction. And you can see here, it embraces an approach that focuses on symptoms within the body. And so the whole goal is to look forward to the self-regulation, self-healing potential by way of functional medicine, cannabis, nutrition, exercise, supplementing with vitamin deficiencies and therapies. So going into hormones, and this is where I'm going to start skipping some of the slides because I wasn't sure of what my audience was going to be, whether it was going to be a younger population, more mature population. So I always start out at this because this is the basis and the foundation of a lot of what goes on in your body. So what is a hormone? It is a chemical messenger used in the body by the endocrine system to coordinate our organs. Okay, so hormones are produced by glands. And these, this is the actual cycle of what goes on in your body. So if we look at the very top, you can see that cholesterol is the mother hormone and the actual synthesis pathway to our sex hormones. And DHEA is the mother hormone to the sex hormones, and sex hormones are testosterone, estrogen, and progesterone. So as we scroll down, this is exactly how it's actually derived in the brain. So we have our pituitary hormones, where a neurosecretory cell is sent through blood vessels, and that releases hormones from the hypothalamus. So the hypothalamus is actually sending the message to the pituitary hormone, and then it's sending out the stimulating hormones. So you can see how, you know, thyroid stimulating hormones activating your thyroid, adrenocorticotropin releasing hormones activating the adrenal glands, follicle stimulating luteinizing hormone with the testosterone, the testes, and the ovaries growth hormone, prolactin, and endorphins, certainly receptors in the brain. So that's the function, the general function of what's going on and how things are actually being sent in the body and how we have growth and development. And obviously each gland is in charge of certain hormones and their actions and what they do in the body. So oftentimes I see many women come in, and some men, thyroid condition. Many women have been on medication for so many years, some where it is actually helping, some they're still experiencing dysfunction. And we know that thyroid is in control of your metabolism and your thermogenesis. So it's your heat control and how your body is metabolizing, weight control, and the like. So here are the 5 levels of your thyroid hormone pathway. You can see here, this is your thyroid gland, this little guy right here in the midsection underneath, well, right at the section of the throat. And you can see all the receptors that can potentially be blocked. There are so many hindrances that can occur within the thyroid. So we need to really look at that with lab work, and we'll go through that at the end. And then this is just showing some of the factors that contribute to proper production of the thyroid hormones. Iron is very important. Iodine, tyrosine, zinc, a cofactor for hormones, selenium, vitamin E, and the B vitamins for sure. So what basically inhibits the production of the thyroid hormone? Stress, big one. I see that one all day. We know stress is a big leader to many disease patterns: infection, trauma, radiation, fluoride, actually plastic bottles. There are many, and certainly on the autoimmune disease, the celiac disease. Okay, so this is where I'm going to slide through. We're going to start going into the hormone pathway. So with women, we know that estrogen is our main hormone. There are actually 3 types of hormones within the term of estrogen. Most people think it's just estrogen. There's actually 3 of them. There's estradiol, estriol, and estrone. Estriol you'll only see when you're pregnant, and estrone is going to be geared more towards menopausal women. Progesterone, what's the role? It really is it actually creates a uterine lining, and it prepares for that fertilized egg when we're in a menstrual cycle. When we're not in a menstrual cycle, it just sloughs off the lining, and it's needed for sleep deprivation, hot flashes, and the like, which we will go into. Of course, testosterone, so these are the main 3 sex hormones. It's commonly known for the sex drive, the libido, vitality, and energy. So what happens, let's see here, let's skip this. The love hormone, oxytocin. I love oxytocin. Oxytocin is secreted in the body when we have lust, when we feel that attraction to someone. That attraction creates a vasopressin, and it certainly secretes quite a bit of oxytocin. Also, when we're in fight or flight, when we're scared, when there's some form of danger that may be upon you. And of course, when we're in love, the muscles relax, it sends energy to the uterus. It's really a beautiful hormone. We feel it quite a bit, especially we have it the most when we have children, or if we have little puppies, because those are babies or little kittens or whatever that may be for you. But that's an important hormone because it also creates that happiness. And today I lecture and I really infuse some of the motivational and inspirational, and you'll see in some of my slides that I say love yourself, because at the end of the day, it doesn't matter what happens, guess what? You're your best friend. And at the end of the day, if you're not with someone, you're always with yourself. So the main thing is to value and love yourself. So how do we do that, right? There are happiness hormones. So when we start to look at happiness hormones, we start to look at your neurotransmitter profile. And you can see here norepinephrine, that's going to be more geared towards your fight or flight. We see dopamine, which is also the happiness hormone. That's a both excitatory and inhibitory neurotransmitter, and certainly serotonin. Everyone knows about serotonin. Most people are taking antidepressants to help with that particular neurotransmitter. So when we go into our menstrual cycle, this is how women feel. You can see that little comic relief. I like that because that's what we feel. We feel like the horns go up and there's fights starting going on. And so we want to understand why that's happening in our body. The brain, ovaries, and uterus work together and communicate through the hormones to keep the cycle going. So again, I'm not going to go through the cycle and see that they were, I'm going to go towards more of the other end of the aspect, which is going to be more of the menopause. But I do go through the entire menstrual cycle. A lot of women are not familiar with exactly what's going on. They know there's a cycle, then it ends. So we'd like to go through that. And in the process of that, a lot of women do suffer with candida. And that's a big topic today. And as we age and we mature, that happens more often. You start to see more urinary tract infections because the vaginal canal starts to get dry, the tissue starts to get dry, and it certainly is a host for bacteria. Pregnancy, I'm going to slide through that one very quickly. I go through the entire pathway of what goes on from menstrual cycle to the actual fertilization, the transcribing of the house cells, how they start to make copies, how your messenger RNA, which is just basically activates gene transcription, and how that happens in a dividing cell, what happens during your trimesters, what hormones are available at that time or in abundance at that time. We know that acupuncture is amazing for fertility. I don't know how many cases with fertility. I worked with a fertility doctor at one point in time, and acupuncture worked beautifully. Can work as a standalone. It can also work in tandem with fertility as well. So there are many points that are addressed within the body for fertility purposes. The main thing that we're doing is getting the mind, body, and soul grounded, trying to eliminate the stress by way of really helping the adrenal glands, and certainly looking at hormones. I'm going to throw this topic in, methylation, because it's a term that's used today, and it certainly applies to fertility as well. It's a core process that occurs in all the cells to help your body make biochemical conversions that regulate the activity of the cardiovascular, neurological, reproductive, and detoxification system. So you can see DNA production, fertility, that's a lot of major stuff in the body. So we do lab work here to see exactly whether you have a genetic mutation or not. We get this gene from our parents. So law of probability says that you 50% chance you're going to get the gene or not. And in most cases today, it's 60 to even higher, 70%. Most people have that genetic mutation. So when we have that genetic mutation, it doesn't allow a switch to go on, right? So the methylation switch is turned off, and these molecules cannot be efficiently produced in the body, which is glutathione. That is your master antioxidant. That is a heavy chelator it pulls heavy metals from the body. It is what I call the warrior of your immune system. So that's an important one. CoQ10, it's where we derive our energy from our mitochondria of the cell, the master house. Nitric oxide, it's a vasodilator. Norepinephrine, serotonin is involved in that. So there are many things that can be done to help control that. And in that case, that's going to be more geared towards the end, which is what I recommend with functional medicine. We have a supplement that is called methyl tetrahydrofolic acid, and that supplement is what gives that methyl bond that's missing when you have a genetic mutation to that whole entire pathway, and allows the switch to turn back on, where you are then allowed to facilitate, the processes that are not vital. If you do not take that, what happens is you're going to start feeling memory fog. A big deal on depression it occurs in that as well. So we want to make sure that we do get tested for that, because it can also affect cardiovascular as well, and that's vital. So we do quite a bit as far as nutrition here. I do recommend, and we do have certain recipes that are methylation approved. We're going to go into estrogen. And again, I do apologize for going really quickly. I do this over the course of different presentations, but I really wanted to get quite a bit in here with respect to the hormones. So what happens when we are in the maturity stage? You can see that in menopause, estrogen starts to definitely become less and less. And as we go through these, here we go. That's what I wanted to see. Unhealthy. So when we have estrogen dominance, okay, that's high estrogen, which is not good. We say what causes malnourished liver, poor detoxification, low protein in your diet, okay? Sometimes dieting with vegan and vegetarian, low carb, that can cause issues sometimes, because there's calorie deficits with that. Low thyroid, sluggish bowels, you name it. There's quite a few things on this list that you can see that definitely wreak havoc. Okay, so the early signs are you feel bloated, swelling and tenderness in the breast. The main thing I'm hearing is decreased sex drive, because it's painful, because it's dry in the cervix, mood swings, headaches, weight gain. All day long I hear about that, weight gain. They're like, oh my gosh, I'm starting to get this abdomen, pouch that I never had before, feeling tired, difficulty with memory, certainly trouble sleeping. So we see to the left that a lot of these things, the alcohol, the caffeine, because oftentimes when we're feeling that way, what do? We tend to go towards the emotional foods and drinks. So the wine starts to become more and more, prominent, certainly the emotional foods. So we want to really start to decrease that pattern, find out exactly where you're having an issue with your hormones, and then do the correct procedure, because I tell women, guess what? 10 out of 10 women do go into menopause. That's all of them. And 10 out of 10 men go into andropause. That's all of them. So it is important to really, really balance your hormones, because if they're not balanced properly, estrogen dominance, which I termed earlier today, can lead into what we call a xenoestrogen, which is a very bad estrogen, hence, you know, cancers and the like. So foods that are rich in estrogen, you can see here by this list, there are many within the fruits, vegetables, grains, seeds, herbs, and spices. So these are called phytoestrogen foods. So these are good foods to help boost the natural production of estrogen. So I also comment that it is important to be careful if there is a history of cancer in the body. So these are anti-estrogenic foods and herbs, and you can see the citrus family, the allium family, that's going to be more of the onions and leeks, certainly the healthy fats, okay, herbs, there are many, many herbs, and then certainly cruciferous vegetables. Broccoli is a very, very good one for that. So when we're going through menopause, these are the symptoms we're getting: depression, headaches. How many women are going on antidepressant medication because they're having hormone imbalance? That is not the right source. So therefore, that's my biggest thing: prevention all day. Find out exactly what's going on in your body first. Do hormone panels to see. I've had women so low in vitamin D levels, and they're on Zoloft and all these other antidepressants with no avail, because it's not that issue. Vitamin D, extreme low vitamin D, can actually cause depression. So we start to look at what we can do to resolve that by way of natural medicine or bioidentical, which I'll go into now. So we can see that a perimenopause can last quite a bit. It can last up to 6 years. So there's irregular cycles going on. But when we do not have a cycle for 1 year straight, that goes into menopause at that point, and certainly postmenopause thereafter. So these are the numbers that I'm looking at when someone comes in and says, am I actually in menopause? These are the numbers that tell me, yes, you are now into the either perimenopause stage or the menopause stage. And this is what we feel. You know, we just don't feel ourselves. We feel very irritable, of difficulty with sleeping. Certainly, we have quite a bit of hot flashes. We have quite a bit of pain in the body. We start to get urinary tract infections because the cervix starts to get dry. We lose our hair. We feel itchy, bitchy, sweaty, sleepy, bloated, forgetful, and all dried up. I like that one. And so, you know, we start to look at ways of how we can bring those hormone levels back up. What causes weight gain in women? There we go. Main 3 hormones up on the top, the sex hormones. Certainly insulin, which has to do with your blood sugars, your thyroid, your control of your metabolism, and cortisol, that stress hormone. So my father, and I wrote this one at the bottom, I am my problem, but I'm also my solution. Vital. We need to know that. We can help ourselves. So these are the 6 hormones that do contribute to weight loss, to weight and health, that can help you. We can help to control that ghrelin hormone, which is that hunger hormone, by way of leptin. We control the leptin cycle by way of a supplement that we have here. We can certainly control our blood sugars by eating properly. And you can see here that hormonal links that are linked to the weight gain. Vitamin D deficiency, a lot of people don't know that. It does create visceral fat gain. Insulin resistance, when we're having an issue with our blood sugars, okay? Estrogen dominance absolutely brings in dominance, especially in the hips, thighs, and breasts. Androgen imbalance, that's going to be more towards men, okay? So this is just the relay station. Again, like I said, I'd like to show women or whoever I'm presenting to the entire pathway of the body, but this one's an important one because your brain sends out a signal that says, hey, I'm hungry. It sends the ghrelin cycle to the stomach starts to get grumbly, sends another signal to the pancreas is pumping out insulin because it's thinking, okay, we're going to prepare ourselves for food. So insulin gets screamed out to the body, and guess what? That is caused, you're getting an actual craving at that point because it's craving. You need to bring in carbs to the body. So when the carbs come in, they'll either go to muscle because it's needed for muscle, for exercise if you're exercising, or adipose tissue, which is fat. So then that leptin cycle signals that whole entire pathway. We can actually help control that. And you can see how important leptin is and all the different cycles that it's involved with, okay? So balancing your hormones. How do we do that? These are, again, some of the foods. All processed foods, no bueno, no bueno. Boxed foods, no bueno. It's better to do, you know, raw or whole foods. Make your own foods. Dairy is a high allergens, I always recommend oat milk or almond, depending if you don't have any intolerance to certain foods. Female imbalances, I'm going to scroll through this. These are all the hormones that work together and balance with each other. So when someone comes in, I'm literally looking at all those areas to create a big picture, okay? I've gone through quite a bit of that here. I'm going to scroll through this. Maca. Maca's great for your hormones. You can buy maca powder in any of the health food stores. Diet and exercise all day long. Again, I'm very big into whole foods, so I'm always recommending whole foods. Acupuncture, very good for anxiety and stress. I'm going to go into the benefits of hemp cannabidiol, which is CBD. I'm a very big advocate of CBD. I lecture at the Cannabis Expo. This office is also a medical marijuana recommending center. It is medicine today, and I love speaking about it. I do have my own private line of CBD, which comes from Colorado, so literally from farm to table. There's no middleman, because some of these benefits, I mean, the benefits are immense. CBD is a homeostatic regulator, so it tries to balance what's going on in the body. And it started out back 4,000 years ago in ancient Mesopotamia and Egypt, okay? It was used for aphrodisiac uses in the 1800s, painful menstrual cramps, painful urination, pain during sex, gonorrhea. You can see the many uses of it. It helps to regulate your cortisol levels. Because it indirectly binds to many receptors in the body, it is great for receptors with respect to gastrointestinal, for cardiovascular. You cannot, the pituitary gland, which sends this messages to the hormones, as you recall, as I mentioned in the very beginning. It is a lipid-deriving system that actually penetrates the blood-brain barrier. So when a woman takes a CBD, it helps with many conditions such as anxiety. That's like number one. Inflammation, up there. Nausea, migraines, sleep disorder, all day long. And you can see that it helps women with mood swings, cramps, anxiety, bloating, extreme fatigue, constipation, even cravings. Within the female reproductive tract, the endocannabinoid receptor, so CBD is known as a cannabinoid. Phytocannabinoid means that it comes from a plant. And when I say endocannabinoid, because our body naturally makes cannabinoids, that's within our body. So they're most dense in the uterus, but they're also found in the fallopian tube, ovaries, the vagina, and the vulva. So that's where we have receptors for cannabinoids. And you can see that when we apply phytocannabinoids to the vulva, it increases blood flow. So this is great vasodilation. Vasodilation creates blood to an area, which hence creates more sensitivity. So I recommend putting the CBD down there. We talk about down there in a minute. You can see here again how it helps because of that whole pituitary hormone secretion. Okay, helps again. There's just super light on that. This is me at the farm with my son in the middle and Jason, someone who is an investor in the farm, and that is the organic crop in there. I have been to the farms, I've been to the labs. I'm very adamant on bringing quality to my patients. So myself and my entire family take it. This is my entire CBD line. We do have it for pets as well, and we have it in different strains, but you can see it's certified kosher, CO2 extracted, non-GMO, organic, and lab tested. They use no pesticides on there. I see little ladybugs on those things. I want to show you this. This is one testimonial. This particular patient has squamous cell cancer, and you can see here that he started applying CBD onto it to the far left. It started actually penetrating out of the skin. You see the middle one where it's now protruding the skin. The other to the far right-hand corner, it actually was starting to come out of the skin. And the last one you can see at the very last slide, it completely came out, and that is completely healed. Needless to say, this particular patient's doctor is now carrying my line of CBD products. Great testimonial. So hormone replacement, what are our options for hormone replacement, okay? So there are many different options, okay? We need to first find out exactly what's going on by way of blood work. so that we can see the benefits of it. So we need to see exactly what hormones are actually depleted. Excuse me for 1 second. Can you please turn that off? I can't hear. Okay. There are many options such as oral cream, patches, injections, pellet therapy. We do quite a bit of hormone therapy with respect to testosterone pellets that are implanted in the tush area for women and in the flank for men. Again, when we look at therapy, we try to stay away so much from the estrogen. It's certainly if there's a history of cancer in the family or the like, and we really start to gear towards the testosterone because the testosterone therapy likes to balance out the other hormones as well. So we do quite a bit of bioidentical here with Dr. Slavin. We also have Dr. Ulferman, which is, we're going to start that shortly. Today's our testosterone pellet day. We have about 10 women and about 5 men, 10 men coming in, 5 women coming in for testosterone pellets. I'm an advocate because I also do testosterone pellets. It helps me with energy, with sex drive. I'm going through perimenopause as we speak. So I was feeling all the nuances here. So I said, no, I'm in this industry. I'm going to utilize what I have here and what I certainly recommend to my patients. So you can see here a lot of the benefits. And Allison, if you want to give me how much time I have so that I can, I'm aware of it because I'm not even sure at this point because I'm just going through the slides. But the main thing is that we want to improve our sex drive. We want to improve our memory. We want to improve our sleep so that we know when we sleep, we feel better, okay? So we also look at growth hormone. Growth hormone is vital. In the 30s, we start to decline with growth hormone. And so that is what makes us look pretty, women. You know, our hair looks good, our skin looks good. So how do we maintain that, okay? Peptides. Peptides are amazing. Peptides are amino acids that our body naturally produces. There are over 7,000 of these peptides in our body, okay? And you can see here, the levels drop 1% each year after our 30s. A lot of us are in the 40s, 50s, 60s, so you can imagine that growth factor and growth hormone must be very, very low, which contributes to, you know, why women are not feeling well, okay? So when we start to do peptides, they help drastically with, you know, sexual function, boosting certainly the growth hormone, lean muscle mass, recovery with your workout, but most importantly, gives you that endurance, acceleration with healing from wounds, great for immune system. I'm personally on thymosin alpha-1 because I've been here throughout the entire, you know, COVID time, and so I keep my health immune system up to par, but we also do IV here, so I do that. But you can see these are the potential best benefits of peptides. I have my assistant, Dion, who is queen of peptides, and she's the one that speaks with someone based on what their symptomology is and what the right peptide would be for them. You can see here we have so many. We have thymosin out. There are so many. We have PT141, which is for the sexual drive. Literally, you feel that blood flow right in that area. Mati, great for weight loss all day long. Peptides can either be injected, orally, topically. I do a cream on the back of my neck that helps me with memory. I do a spray that also helps me with memory. I do an injection, which helps me with immune system. I do a cream. So there are many. So this is just your peptide therapy. We'll send that out in form of slides. We have
Brazelia.
Certainly we have. Yep.
Just so you know, you've got about 5 minutes, and then we'll do
Perfect.
Q&A.
Perfect. Okay, good. So I'm going to flip through some of these, and I'm going to go through here. Happy hormones. That's what I want to go through. Let me just go through this. I can't really go into the neurotransmitters at this point because I want to show you more of the slides these are some of the labs that we do, which are pretty extensive labs. Our labs are about 16 to 17 pages. This is our brain testing where we can see exactly what's going on with your neurotransmitters. So we can assess whether there's a sleep cycle issue, whether there's depression, clinical depression, and then this is the regimen, the protocol that we give our patients. So the designer vagina, I call it the designer vagina because people want to get their sexy back. They want to have their vagina looking good there too. No one really looks down there anymore. So we do quite a few therapies for that. We have the Votiva, which is a vaginal one that goes in. And for those that are interested in looking at pictures, because I see a gentleman on there and I guess he won't want to see that. I can email pictures that you can see that some of the amazing therapies where the vagina was actually opened. You can see on the slide there, and it actually tightens right back up. So not only does it tighten up on the outside, it tightens up on the inside. Why? Because that heat, that radio frequency is inducing heat to the tissue and restoring that tissue membrane. So it decreases, it gets rid of, well, I'm going to say decreases UTIs, helps tighten. This is the one treatment that actually husbands are actually paying for, okay? We also do the O-shot to help the clitoris gain blood flow through that area. We do quite a bit of vitamin C IV therapy here because we do have our Liquivita IV lounge. It's one of the #1 therapies right now to beat the COVID. So that's good. This is another, some pictures here to the left. You can see how her face was crinkly, and through way of radio frequency, platelet-rich plasma, and PDO threads, you can see the tightening that I did there. To the right with the neck, you can see this is a thermi machine. See her neck, how she had all the fat underneath. To the right is her outcome, no fat there. To the left, on the bottom is a stomach as well. So we do get rid of the fat, but not only do we get rid of the fat, we actually tighten the tissue. So that's important. We talk about hormone, the bioidentical pellets. Pelvic floor is something that I teach women. It helps relieve back pain, but also helps to strengthen all the organs in there. Okay, these are just exercises. A case related, woman came in with hot flashes, low libido, severe anxiety, chronic UTIs, extreme lethargy, dry skin. Weight gain was the main thing. She was really, perturbed about that. And these were her goals. She wanted to feel good. She did have a partial hysterectomy and hypothyroidism, and had a history of ovarian cancer from her mother's side. What her plan of regimen was, we did testing, full comprehensive lab. We did a micronutrient panel to see where her vitamin level was. We also did a brain test to see exactly what was going on with her neurotransmitters. We also did a food intolerance test. It showed exactly what her body was actually allergic to and intolerant to. Once we assessed that, we put her on a healthy regimen, and these are the supplements. Now, it's going to be geared towards someone, and we customize everything to the person because not everyone is the same. So she did get, she opted for bioidentical pellets. She did go on hemp CBD, acupuncture. She did IV cocktails once a week and did the radio frequency both for her body contouring and vaginal rejuvenation. So this is what we do with integrative functional medicine and hormone therapy. We combine it to get a happy result. So sometimes it's not one method, it's the sum of the methods that makes a difference. And so at the end of the day, this is where it really boils down to. Self-love is asking yourself what you need every day, and then making sure you receive it, because that's vital. And this is my personal testimonial. Like I mentioned, currently in perimenopause, I practice self-love every day. I meditate and pray. That is vital for me. I always do the best I possibly can because that's what you got, right, to give. Always do the right thing with integrity. Keep on thriving, never striving. You're thriving. And let go of what doesn't serve you anymore, because that's just weight on you. Just got to let that go. I follow the 6 best doctors. I exercise, I hydrate, I drink water, get sun, rest, good diet, fresh air. And I love Tony Robbins because he's taught me a lot. He's my mentor. And that's me. I thank you so much for this time. Again, I apologize it was quick. Anyone has questions, you can certainly email me or certainly call me at that number below. And I want to send everyone blessings, good love, good health, and certainly keep yourself safe. So from my heart to yours, thank you.
Great, thank you. Do we have some questions we can take?
I am curious whether any insurance is covered. Any of your services?
Yeah, absolutely. We do. We're out of network. We do take health insurance. We verify it first so that we make sure that there's no, hidden secrets or anything of that kind. And then once we assess that, we tell you exactly what your treatments will what your insurance will cover. Mm-hmm. The insurance will cover labs. And Medicare covers the vitamin nutrient panel 100%. So there are certain things that are completely covered by insurance, and there are some that are not.
Fabulous. Thank you.
You're welcome.
Anybody else? You can just unmute yourself and ask a question. Okay. Then I want to thank the doctor for her time. It was a great information, great presentation, a lot of valuable information. I think we all learned something today. I also want to remind everybody that if you enjoyed today's programming, please download our app. You can get notifications, push notifications of all the programs that we have and register for them online. And so with that, I want to thank you guys again for attending. Enjoy your weekend, and we hope to see you on the next virtual Zoom. Take care.
Thank you so much. Have a great weekend, everybody.
Bye-bye.